Assalamu alaikum dear students, welcome to your channel The Anatomy Canvas. In today's class we are going to discuss the MCQs of cross anatomy of GIT and the renal system, and these MCQs are again taken from the internal exams of different medical colleges. So first MCQ is vein of the left suprarenal gland drains into external iliac veins, the femoral vein, the inferior vena cava, the internal iliac veins and left renal vein. And this is the diagram which shows you that the left suprarenal vein drains into the left renal vein. So E is the correct option. Next MCQ is a male patient of 40 years of age comes with a complaint of urinary urgency, difficulty in initiating micturition, terminal dribbling of the urine and poor stream. The probable diagnosis is either urinary stones, rectal cancer, renal failure, the UTI and the benign prostatic hypertrophy. So remember, look at the age and then the complaints that urgency of urination, the difficulty in initiating dribbling of the urine and poor stream. So these all are classical signs of the benign prostatic hyperplasia and it is the correct option. Next MCQ is a fair, fat, flatulent 40 years woman with the 5 children was rushed to the hospital with severe colicky pain in the right upper quadrant of her abdomen near epigastrium, which then shifted to hypochondric region and right side of her back, that is lower end of the scapula. So pain followed by a heavy meal containing fatty food causing nausea and vomiting. So what is the most likely diagnosis in this female? So look at the scenario, that is fair, fat, flatulent, 40 and fertile. 5F are typical diagnosis of the cholecystitis. So these features and then the symptoms, they are giving a clue that this is the patient of the cholecystitis and this is the diagnosis. Next is a 22-year-old married female medical student woke up one morning feeling anorexic and had crampy abdominal pain. She had slight fever and felt dizzy, so she stayed in the bed. By evening, the site of the pain shifted to right lower quadrant of her abdomen and intensity also increases. What did she suspect about her condition as a medical student? So that may be acute appendicitis, diverticulitis, dysmenorrhea, ectopic pregnancy or acute peritonitis. So please remember the diverticulitis, the pain is usually on the left side. Either it is dysmenorrhea or it is ectopic pregnancy. In both of the condition, first there is no fever and secondly there must be a history of the menstrual cycle or the gestational amenorrhea, which is not mentioned, and these are not the typical features of the acute peritonitis. So we are left with the acute appendicitis and this is the answer. Next is a 50-year-old obese man with history of the heartburn and belching after heavy meals complained about recent epigastric and retrosternal pain. The pain was most severe after dinner. When he stooped down, he recently had bouts of the hiccup and occasionally had difficulty swallowing. On examination, his ECG was normal. What would be your diagnosis in this patient? That may be angina pectoris, duodenal ulcer, esophageal stricture, peptic ulcer or sliding hiatus hernia. So please remember, as ECG is normal, this may not be the angina pectoris. Then remaining condition, first remember, if the patient got worse after eating something, it is of peptic, it is of the origin of the stomach, and if the pain is relieved after taking some food, the pain is because of the duodenal ulcer. So in this condition, the patient has a severe pain after dinner and when he stooped down, and there are bouts of hiccup and occasionally had difficulty swallowing. So these symptoms typically give a clue about the peptic ulcer. If there will be sliding hiatus hernia, then there will be a typical history that patient's even appetite is decreased, and he can take very little amount of food, which is not mentioned in the scenario. So most probable diagnosis in this case is the peptic ulcer. Next MCQ is, which of the following is a posterior relation of the inferior vena cava, that is a peritoneum, the superior mesenteric vessels, right renal artery, head of the pancreas, or inferior surface of the liver. So look, this is posterior relation of the inferior vena cava, and look at this diagram. This is inferior vena cava and its posterior relation. You can see the right renal artery is present posterior to it. So this is the answer. Next is, during an appendectomy, the surgical resident asks an attending senior medical student the following question. When making a transverse incision in anterolateral abdominal wall, which nerve must be identified and preserved in order to prevent post-op direct inguinal hernia? So genitofemoral, iliohypogastric, ilioinguinal, posterior cutaneous nerve, and transverse cutaneous nerve. So please remember that the ilioinguinal nerve is present in inguinal canal along with either the spermatic cord or the round ligament in female, and it should be secured and preserved and identified during surgery. So this is the answer to the question. Here in this diagram you can also look at this, that this is the internal ilioinguinal nerve which is present along with the spermatic cord in the inguinal canal. So ilioinguinal nerve is the answer. Next is, which one of the following structure is crossed by left part of root of the sigmoid mesocolon? That may be right ureter, left ureter, the right common iliac vessels, right psoas major, or inferior vena cava. So look at this diagram. This is the root of the mesocolon. Here right mesocolon is present, sigmoid mesocolon, and it is crossed by the, it is present, and the ureter is present behind it. So left ureter it is the correct option, because this right sigmoid mesocolon crosses the left ureter. So correct option is the left ureter. Next question is, abdominal aorta runs from the diaphragm and ends just above the pelvis at the level of the fourth lumbar vertebra. So during its course, it gives off numerous branches to abdominal structure. Which of the following branch of abdominal aorta supplies the liver? This is a very simple question. We all know that a celiac trunk is the artery of the foregut, and it gives off right hepatic artery which supplies the liver. So celiac trunk is the answer to this question. Next is, a 54-year-old mechanic was admitted to hospital because of the severe epigastric pain and vomiting of the blood, that is hematemesis. He had been drinking alcohol heavily. He previously had upper GI bleed but not profuse. On examination, the vomitus was bright red, blood pressure was low, pulse rate was high, slight jaundice. On palpation, his liver and spleen were enlarged, caput medusae around the umbilicus. So this patient is a typical case of acute cholecystitis, acute esophagitis, acute myocarditis, cirrhosis of liver, or portal hypertension. So please remember, patient is alcoholic. There is epigastric pain and hematemesis, low blood pressure. On palpation, liver and spleen are normal or enlarged, and caput medusae, that are the enlarged vessels present around the umbilicus, is a typical feature of the portal hypertension. So this is the answer. Next is a 32-year-old accountant complained to her physician about a steadily burning pain of about 2 weeks duration in the pit of her stomach. On careful questioning, it was revealed that pain usually began after 2 hours, about 2 hours after she had eaten, and then disappeared when she ate again and drank a glass of the milk, except for mild tenderness in right upper quadrant. Which structures are most likely to be if eroded by the perforated ulcer? That may be aorta, colon, gallbladder, liver lobule and pancreas. So please remember the pancreas is present within the C formed by the duodenum, and it is the organ which seal off any perforation. So it is the first organ which will be affected and eroded by any perforation of the duodenal ulcer. So this is the answer. Next is a 42-year-old office worker suddenly experienced a sharp tearing pain in his right lumbar region. The pain was excruciating and fellow worker took him to hospital in a severe agony. So look at the region, this is the right lumbar region. The pain was not continuous, lasted for 30 minutes but suddenly eased. Pain seemed to be moving towards his groin. On examination, doctor noticed the right testy was unusually tender and retracted. Urination was painful. Urine sample contained blood, which is most likely diagnosis in this patient. That may be bladder stone, left kidney stone, left ureteric stone, right kidney stone, or right ureteric stone. So please look at scenario. This is the pain in the right region. So we are left with the right kidney stone either or right ureteric stone. Then another condition, that pain lasted for 30 minutes and then ceased, means it has passed through constriction of some constrictions which are normally present in ureter, and it may have entered into the urinary bladder. So the stone was present in right ureter, and this was the answer. While observing an cholecystectomy during open surgery, surgeon reported severe bleeding. The blood flow was quickly arrested and bleeding vessels were treated by the electrocautery. So this is scenario. What other surgical procedure is used to remove the gallbladder? That is barium meal cholecystectomy, laparoscopic cholecystectomy, MRI guided cholecystectomy, open CT cholecystectomy, or the US guided cholecystectomy. So this is the laparoscopic cholecystectomy, which is other procedure which is preferred above the open surgery. Next MCQ is a teenage boy receives a stab wound in anterior abdominal wall below the umbilicus in a street light. He does not seek a medical advice for fear of the police station, and his wound become infected. In this case, which group of the lymph node will be enlarged? So look at the scenario. This is the abdominal wall injury below the umbilicus. So the lymph node will drain the abdominal wall below the umbilical or medial group of the superficial inguinal lymph node, and this is the answer. Next is topic of discussion in the small group discussion session was omentum. So it was asked that which one of the following structure is the content of greater omentum. That may be left gastric artery, right gastric artery, the cystic artery, the right gastroepiploic or inferior phrenic artery. So please remember in the greater omentum, right gastroepiploic artery is present, and this is the answer. Next is a 58-year-old man comes to emergency department with the retention of the urine for which he is catheterized. Next day, his ultrasound examination shows an enlarged prostate, possibly causing obstruction in prostatic urethra. Which of the following lobe of prostate gland is commonly involved in benign hypertrophy. So please remember, out of these, the median lobe is one which is in all of the cases will be affected in case of benign prostatic hypertrophy, and in case of the CA prostate it will be the posterior lobe. So the question may be either for the benign prostatic hypertrophy, so you have to write down the median lobe, and if the scenario is about CA prostate, then you have to write the posterior lobe. 75-year-old man presented with bleeding per rectum. A colonoscopy revealed a rectal adenocarcinoma. In which part of the large bowel do most colorectal cancers occur? A question usually from pathology. It may be ascending colon and rectum, the cecum, the descending colon and rectum, sigmoid colon and rectum, transverse colon and rectum. So this is the sigmoid colon and rectum, which are the commonest places where the rectal adenocarcinoma is present. Next MCQ is a 70-year-old man complains of difficulty in passing urine. His urine examination shows blood in the urine. Further investigation confirms the diagnosis of cancer of the prostate gland. So in this disease, which of the lobe of the prostate is most commonly involved? First of all, so anterior, median, posterior, left lateral or right lateral. So as I have previously told you in the slide that this is the posterior lobe, which will be the first lobe which will be affected in case of CA prostate. So this is the answer. Next is regarding the gross features of the peritoneum. Which one of the following structure is crossed by root of the transverse mesocolon? First part of duodenum, right ureter, right psoas major, anterior surface of the pancreas, or the abdominal aorta. So look at this diagram. This is the root of the transverse mesocolon, and it is present. The structure which is present behind the root of the transverse mesocolon is the pancreas. So this is the answer. Next is that at what level does the aorta pass through the diaphragm and the celiac trunk arises? That may be the T10 level, T11, T12, L1 or L2. So look at this cross section. This is the central tendon of the diaphragm. At the level of T10, esophagus is passing. At the level of T8, inferior vena cava is passing, and at level of T12, aorta is passing through the diaphragm. So here the correct option is T12, that is C. Next is that during an STD session, the professor asked the student which one of the following structure is crossed by root of mesentery attached to posterior abdominal wall. That is left ureter, left psoas major, left common iliac, first part of duodenum, or the inferior vena cava. So in this diagram you can see this is the root of the mesentery. This green color shows the root of the mesentery, and it crosses the inferior vena cava which is present behind it. So correct option is E. Next is which part of the duodenum is connected to the liver by the hepatoduodenal segment? A very simple question. This is the first part, the superior part from which the hepatoduodenal ligament is attached. It connects the liver to the duodenum. So this is the diagram. You can see this is the hepatoduodenal ligament, and it attaches the duodenum to the liver, and it also contains the common bile duct, portal vein, and hepatic artery proper. Next is which of the following is most commonly affected organ by metastasis of the colonic cancer? This is again another MCQ from the pathology. This may be bones, brains, liver, lung, and spleen. So please remember the metastasis of colon, metastasis of the colonic cancer affects the liver, and this is the answer. Next is that which of the following forms the posterior wall of the inguinal canal? That may be internal oblique, inguinal ligament, aponeurosis of the external oblique, fascia transversalis, or the lacunar ligament. So look at this diagram. You can see this is the inguinal canal which is present containing spermatic cord, and in addition to this the ilioinguinal nerve is present, and this is the transverse sallus fascia which is forming posterior wall, while external oblique aponeurosis is forming the anterior or the cutaneous wall. So here the correct answer is the fascia transversalis, that is D. Renal cell carcinoma can metastasize via lymphatic system. So which lymph node primarily drain the kidney? That is internal iliac, mediastinal, para-aortic, superficial inguinal, or deep. So the kidney, the lymphatics of the kidney drains to the para-aortic lymph node, and this is the answer. Next is, one of the contents of the lesser sac are the hepatic vein, hepatic artery, inferior mesenteric artery, superior mesenteric vein. A very simple MCQ, and correct answer is that this is the hepatic artery which is present in the lesser sac, and which are the contents of the lesser sac. In this you can see the hepatic artery, the bile duct, and the portal vein which are present. So correct option over here is the B. Next is, commonest site of the vermiform appendix is either pelvic, retrocecal, paracecal, anterior, or subcecal. So this is retrocecal appendix which is most commonest, and this is the answer. Next is, the abdominal aorta gives off many visceral and parietal branches during its course through the abdomen. Which of the following is a paired visceral branch of the abdominal aorta? The inferior phrenic artery, celiac artery, gonadal artery, or superior mesenteric artery. So please remember, inferior phrenic artery, on one side it is given by the aorta, and from the other side by the renal artery. Celiac trunk is not branched, then superior and median sacral artery are also not branched. The gonadal arteries are the paired arteries which arises directly from the aorta and supplies the viscera. So these are the answer. One of the contents of the mesoappendix is appendicular artery. So appendicular artery is a branch of which of the following arteries? That is, right colic branch of superior mesenteric, the middle colic branch of the superior mesenteric, ileocolic branch of the superior mesenteric, left colic branch of inferior mesenteric, or superior rectal branch of the inferior mesenteric. So this is ileocolic branch of superior mesenteric artery. The appendicular artery arises from this. Next is, in which part of the large bowel do most colorectal cancers occur? Again another MCQ from the pathology, that may be ascending colon, the rectum, cecum, descending colon and rectum, the transverse colon and the rectum, and sigmoid colon and the rectum. And correct option is sigmoid colon and rectum. These are the parts of the large bowel where usually colorectal CA occur. Next is, a 65-year-old man with retention of the urine comes to the emergency where he is catheterized. Which part of the urethra is narrowest and least dilatable? So this is very common MCQ, usually present in your exam. The part of the urethra are the prostatic, bulbous, membranous, penile, and navicular. So please remember, this is the membranous part of the urethra which is the narrowest part and least dilatable part, and this is the answer. Next is, a man was referred by his primary care physician to a surgeon for vasectomy. Knowing you was a medical student, which of the following structure is cut or ligated during this procedure? Very simple question, very simple question. The different options are there, and we know the vasectomy is done to cut the vas deferens or ductus deferens, and this is the answer. Physical examination of an infant with severe periumbilical infection revealed enlarged lymph node. So look, this is periumbilical and enlarged lymph node in both axilla and inguinal. What region other than abdomen would you not prefer to examine for the infection? That is axillary, cervical, inguinal, pectoral or subscapular. So correct option over here is subscapular lymph node, which will you are not supposed to look at the infection in this area. Next is a third year medical student was invited by a senior surgeon to observe an abdominal exploratory operation on a patient with intestinal obstruction. According to your knowledge of anatomy of the anterior abdominal wall, which nerve is most likely to be damaged with the pararectus incision? So these may be the anterior rami of T7 to T12, ilioinguinal, intercostal, subcostal, or thoracoabdominal. So the correct option is anterior rami of the T7 to T12 nerve, which pass through the rectus abdominal muscles and which are most likely to be cut in pararectus incisions. Next is the initial complaint of a 54-year-old man was a oval swelling in his left groin. He stated that this painless swelling enlarged when he coughed and disappeared when he lies down. Patient is a typical case of the direct inguinal hernia. How will the surgeon differentiate it from indirect inguinal hernia while examination? So it is present inferior to the inferior epigastric artery, lateral to the inferior epigastric, medial to inferior epigastric, posterior to inferior epigastric, or superior to the inferior epigastric artery. So look at this diagram. This one is the direct inguinal hernia and this one is indirect inguinal hernia. And direct inguinal hernia, the hernia is present medial to the inferior epigastric artery, while indirect inguinal hernia present lateral to inferior epigastric artery. So C is the correct option over here. Next is a man was struck by a knee in the groin. He doubled up and complained of the severe groin pain. He also said that he felt sick to his stomach, that is nauseated. How will you justify the pain in periumbilical region? That may be arterial blood supply to the testes, the autonomic nerve supply, dermatomal, local trauma and abdomen, venous drainage. So these are the autonomic nervous system which are responsible for this pain, and this is the answer. Next is a young woman complained of the pain and tenderness in the lower pelvic area and urge to urinate frequently and pain upon urination. So look, this is pain and tenderness in pelvic area, urge to urinate frequently and pain on urination. She has fever and on investigation she has pus and bacteria in her urine. So what is the main cause of this condition? That may be Bartholin gland, that may be broader subpubic angle, bulbocavernosus muscle, narrow urogenital diaphragm, or UTI due to short length of the urethra. So this is most common cause of UTI in female patient, because in females the length of the urethra is very short and usually female patients are affected by UTI, and this is a typical feature of the UTI, that she has pain, she has temperature, she has pus and bacteria in her urine. Next is a young woman was thrown from his motorcycle, complained of sharp pain on his left side and held his hand over his lower rib. Radiographic studies revealed fracture of 10th and 11th rib. Which of the following organ is responsible for his pain? So please remember, when 10th and 11th ribs are fractured, the most commonly affected organ is kidney, because it is present in relation to the 10th and 11th rib, and this is the answer. Next is, during an operation for the partial gastrectomy, it was found that posterior wall of the stomach was stuck down to posterior abdominal wall. The surgeon had to proceed with great care to avoid damage to which of the following important structure, that is cecum, esophagus, inferior epigastric, kidney and the suprarenal gland. So this is the inferior epigastric artery which is present behind the stomach in relation to the posterior wall of the stomach, and surgeon has to be careful about it. So this is the answer, that is C. A 16-year-old boy received a severe kick in a right flank while playing football at the school. On examination, his right flank was severely bruised and right costovertebral angle was extremely tender on palpation. The urine specimen show microscopic hematuria. So which of the following organ has been injured in this case? That is cecum, duodenum, kidney, spleen or stomach. Again, this is kidney which is injured in this area, present usually right side, and showing that the urine contain the blood. It is another point which gives you a clue that this is the kidney which is affected. 17-year-old boy was involved in a gang fight with use of the knives. He was examined in emergency room for a bleeding wound in his left flank. Urine specimen revealed frank blood. So which of the following organ is least likely to be damaged? So remember, this is the organ which is least likely to be damaged, with the organ which will be present to the in relation to the right flank and not the left flank. So these may be coils of jejunum, inferior vena cava, left colic fracture, left suprarenal or spleen. So the inferior vena cava is present slightly on right side and it will be least likely to be damaged. So this is the answer. Next is an obese man complained of tingling, burning, pain and needle sensation and pain on lateral side of his thigh after a laparoscopic inguinal hernia repair. Which of the following nerve has been compressed during the procedures? That is anterior cutaneous nerve of thigh, the lateral cutaneous nerve of thigh, posterior cutaneous nerve of thigh, sciatic or obturator nerve. So look at this diagram. The lateral area of the thigh is supplied by lateral cutaneous nerve, and this is the answer. So next MCQ is fracture of which of the following ribs can cause damage to the kidney? That is 7, 8, 8, 9, 9, 10, 10, 11 or 11 to 12 rib. So look at the diagram. These are the relations of the right and the left kidneys, and 11th and 12th rib are present, and on right side only 12th rib is present. So this is 11 to 12 rib, which is the answer, and this is your last slide. Thank you very much for your attention for today's class. Wish you very best of luck for your professional exam. May you succeed with flying colors. Thank you so much. Allah Hafiz.